You're listening to Well Within 10, a bite-sized approach to working on your wellness. 10 minutes of wellness thought leadership from experts across the country, hosted by me, Stevi Carr. Today, we are chatting with Dr. Burns Blaxall, the founding executive director of precision medicine at the Christ Hospital Health Network. He leads efforts to transition from reactive to proactive healthcare delivery by harnessing the power of personal, diagnostic, and genomic data. Burns, thank you so much for being here today. I appreciate it.
Well, thank you very much for having me. It's an honor to be with you, and my personal congratulations for everything you've been able to and will continue to accomplish with Wise Wellness and your entire
Thank you so much. You're always such an incredible ally. We're so happy to have you here. And the work you're doing is incredible on precision medicine. What are we going to be chatting about today?
So I guess just a brief introduction of what is precision medicine. We did kind of a market survey, and most people don't know what it is, but when they learn what it is, we actually learned that about 40% of patients would actually change their provider to someone who does it. So our view of precision medicine is kind of at a global standpoint. First, being very proactive in evaluating hereditary or genetic disease risk. Those largely surround cancer and cardiovascular disease, as well as a lot of monogenic diseases like cystic fibrosis or something like that. And the other main component is using your genetics and diagnostics to make sure that we understand how your genes may impact the way that medications behave in your body. That's called pharmacogenomics. So overall, that's really what it is. And then it's using a lot of artificial intelligence to make sure we're making all the right decisions with your healthcare.
That's incredible. And I'm so excited to dive in. As you know, this episode is sponsored by the Christ Hospital. For more than 130 years, the Christ Hospital has been dedicated to providing the best, most compassionate care for our community. By continually reimagining what healthcare can be, we have become more than just a hospital at the Christ Hospital Health Network. Today, they're an extensive network of 6,500 employees, 1,200 physicians, and 600 volunteers, serving more patients at more than 100 locations throughout the greater Cincinnati area. Learn more at thechristhospital.com. So I know, Dr. Blaxall, as we talk about hereditary disease risk and what precision medicine can do to understand that risk, we're also amidst Breast Cancer Awareness Month. And I know that, there's a lot of discussion around hereditary disease risk and understanding BRCA gene. There's a lot of, there's a lot of buzzwords around this time of year. And so I'd love to dive in and just learn more about some of the work that you're doing and leading at the Christ Hospital that can really help us understand our risk.
Sure, thanks. Again, for a terrific question, and happy to dive in a little bit about what we've been trying to do with that. So many people have heard about BRCA 1 and 2. We really want to be proactive and partner with patients as well as their families in trying to understand what the inherited risk that a patient may have for cancer. So there's something called the National Comprehensive Cancer Network, and they have guidelines for who should be tested for hereditary cancer risk. So we have an outstanding partner with whom we worked to develop and implement something called a chatbot, kind of like that thing when you're shopping online and the bottom corner is
super easy. Yeah,
right.
That helps you guide you through. Yeah,
exactly. And so this chatbot actually gets delivered. We launched first in mammography because of the known hereditary cancer risk for breast cancer. And before a woman comes in for a mammogram, 5 days before her visit, we send out this interactive natural language processing chatbot that just interacts with the patient and asks them questions, records the answers within the medical record in a very HIPAA-compliant way, and evaluates whether or not the patient meets the guidelines set by the National Comprehensive Cancer Network for hereditary cancer testing. And then it also calculates a score called the Tyrocusa Score. And this is basically a lifetime risk of breast cancer score that incorporates not only family history, but also other things like age, menarche, and first childbirth and menopause and other things like that, environmental impact. And so we've used this chatbot over not quite the last year, about 11 months. And we have used it, and almost 19,000 patients have responded and filled out the chatbot. And of those patients, over 4,600 have actually met the National Comprehensive Cancer Network guidelines for genetic testing. And of those patients, there are about 1,200 who meet that Tyrocusa score. And I should have mentioned when a patient meets that score, they then generally qualify through insurance, not only for genetic testing, but also for more frequent or higher resolution screening for breast cancer, like MRIs instead of mammograms, et cetera. And then there's another additional about 1,100 patients who have met that Tyrocusa score without the genetic score. So for me, I'm super excited. We know about hereditary disease risk. These patients can be seen in our high-risk cancer screening clinic, where they either see a genetic counselor, or if they meet both scores, they see a genetic counselor and an advanced practice provider who's specialized in breast cancer. And we can design a plan to help them with not only prevention, but then also early detection and treatment plans.
That's incredible.
So it's been super exciting.
So you're catching cancer before it even starts, and you're understanding risk levels and just helping guide people to better understand how they can manage their risk as they age. It's incredible because truly at Wise, we talk so much about what is it going to take for people to start being proactive about their health and wellness? And how do we start to take this into our own hands? And this is just one way that the Christ Hospital is really trying to help support that mentality of getting ahead of this. It's absolutely incredible. And I love that it's so friendly. It's the Gia Chatbot. It's something that can help us and technology leveraging in a really fantastic way. That's awesome.
Yeah, it's super exciting. And it literally takes 3 to 5 minutes. But the beauty of a chatbot that you fill out at home is, unlike when you're in the doctor's office, you have 1,000 questions, they're asking you 1,000 questions, and then you forget everything, which often happens. You can do it at home, and you can pause, and you can call up Aunt Sally and say, hey, was that breast cancer you had? What age was the diagnosis? And so it's really, it's just a much easier way to practice evaluation and catch things early. And as you mentioned, early detection with any disease, and particularly cancer, is the key to effective treatment.
Right.
In our current medical system, things are designed to be very reactive. We wait to go to the doctor until it's almost too late because there's cost associated and all sorts of impediments that get in our way. And this is just a way to be proactive. And one other thing I wanted to mention is that after we do the testing, in the event that a patient is found to have an actionable mutation or something that leads us to believe that you are predisposed to cancer, we can develop that proactive, preventative detection and treatment plan with you. But we also partner with your family, and any blood relative can be tested for free for that same variant. So it's just, for me, it's really impactful because we can help patients and their families be proactive about their health.
And we know that women are so invested in supporting not only the women, other women in their lives, but their entire families. And what a way to show up and support each other and our communities by being able to be proactive about also helping our families. I mean, it's just really, really encouraging and exciting to know that we are on the forefront truly of what this next generation of health and wellness looks like. And I'm so grateful that you are here in this region, Dr. Blaxall. You are, like I said, an incredible light of hope here, but also, like I said, an incredible ally for women. And the work you're doing to continue to advance this at a very strategic level has just been it's been very inspiring. So thank you so much for being here today.
Thanks so much for having me, and hopefully we'll talk again. Stay tuned. We have a lot of other exciting things going on I'd love to tell you about.
Oh, wonderful. Well, if you are interested in learning more about precision medicine at the Christ Hospital, you can check us out at shop.wisewellnessguild.com and type in precision medicine to learn more about the early preventative care, about understanding your risk, and really engaging to be able to support yourself and your family. Thank you so much, Dr. Blaxall. Have a great day.
Thank you as well. Thanks for having me.